Hi, hello to all my dear lovely nursing officers. This is your Sumant, and I had secured an All India rank of 102 in recently conducted Aiims Norcet exam. And in this video, I'm going to discuss the time planner for Aiims Norcet 2022 exam for this last 45 days. See, the exam date had been already announced by Aiims in the official website. Like they are going to conduct the exam on September 11th. Right, so you have only 45 days to 50 days. You have very short period to crack your exam. So in this last 45 days to 50 days, don't go through your textbooks, okay, or don't go through the entire topics of all the subjects. I don't recommend that. Okay, only go through the high yield topics. Only go with the rapid revision. See, high yield topics, they are readily available in the YouTube by different channels. You can go search in the YouTube, you will get the high yield topics. Make a list of those high yield topics and start preparing for your Norcet exam. Again, I am telling you, only go through the rapid revision of high yield topics alone. If you want to follow this time planner, you can follow this, or you can also follow your own time planner. But commitment is very, very important. Commitment to the time planner is very important in this last minute to crack your exam. And also be consistent. At least you have to study for 8 to 10 hours in a day to crack the exam, right? So let us start with the time planner. This is an initial go through, right? For the people who have not started your preparation, this becomes your initial go through. But for the people who have already studied once, this becomes your revision. Okay, obstetrics and gynecology will start studying from tomorrow, that is 22nd July, and you will end it by 25th July. 4 days you have to complete your midwifery nursing, and make sure that without studying these topics you are not going for exam, where I have highlighted in the red pen. See here, drugs, instruments and contraceptives are very, very important. They are very frequently asked in your exam. So without studying these topics, don't go for the exam. And next, the fundamentals. Once you complete your obstetrics and gynecology, then you will start with fundamentals of nursing. So 26th July to 27th July, that is 2 days, you are going to study your fundamentals of nursing. While you are coming through the devices or instruments like cath mount, HME filter, TPs, etc. So you should Google it immediately and download that image and save it in the image library. And before the exam, you have to revise those images also, because Aiims Norcet is more fond of asking the image based questions nowadays. So that's why you have to go through the photographic memory. This is called photographic memory. Okay, make an image library and go through that. That will really help you to crack your image based questions. And make sure that while you are studying your fundamentals of nursing, these topics are also covered. Images of all the devices and catheters, I have already told you to save that in your mobile. And sizes and color codings are also very important. Sizes of different IV catheters, Foley's, Riles, okay, and color coding of anesthetics. These are very important. Make sure that these topics are also covered along with your high yield topics. Then you will start with the medical and surgical nursing. So from 28th July to 31st July, 4 days you will study medical and surgical nursing. And here again I have highlighted with the red ink. So that is very important to be covered while you are studying your medical and surgical nursing. So ECG, for sure you will get one ECG in your exam. For sure you will get one X-ray in exam. And ABG analysis, for sure you will get. And also the radiological tests and surgery instruments you also should cover these topics while you are studying the medical and surgical nursing. Okay, so in future I'm also going to make the videos on ECGs, how to interpret the ECGs. X-rays is already available on my channel, and also I'm going to make the videos on ABG analysis. So stay tuned guys. If you have not subscribed to my channel, do subscribe to my channel so that whenever I post these videos, you will be notified. After your medical and surgical nursing, you will go through the pharmacology. From 1st August, you will start with your pharmacology and complete it by 3rd August. So 3 days you have to complete your pharmacology subject. So make sure that while you are studying pharmacology, these topics are also covered. Serum therapeutic levels of few important drugs, where as a nursing officer, you are going to monitor the serum drug levels. Like you have to monitor for the digoxin, lithium, magnesium sulfate, right? So there are other drugs also. So see to that you are studying that. Make a separate notes and revise it frequently so that you don't forget it. And then specific side effects like chloramphenicol has a specific side effect called gray baby syndrome. Thalidomide has a specific side effect called phocomelia. Like that, you have to study the specific side effects also. That also will be asked in the exams. Antidotes. For both the drugs and poisoning, you have to remember the antidotes. So nursing responsibilities before administering the drug also is very, very important. Like before administering digoxin, what you are going to assess, these kind of questions will be asked. So don't leave these topics in pharmacology. Once you complete your pharmacology, then you will start with your pediatrics. So from 4th of August to 6th August, that is 3 days you have to complete your pediatrics. Okay, then while studying pediatrics, don't go through the growth and development in detail. I just suggest you to go through the MCQ discussions of these growth and development, where they are available by the different channels in the YouTube. You can go search it and you can attend the MCQ discussion alone. Don't go through the entire theory. It will take a lot of time. Because the time is short, always try to do a rapid revision, right? So, and very importantly, while you start with your child health nursing, always start with your cardiology, right? And hematology. For sure you will get the questions from cardiology and hematology. So initially start with these subjects, like these topics, and go with the other systems. Okay, of course you will get questions from the other systems also, but these two systems are very important. So try to cover in the first, right? So next, once you complete with your child health nursing, start with mental health nursing, that is your psychiatry. From the 7th August to 8th August, 2 days you have to cover your psychiatry. Okay, don't try to cover the entire subjects, not only for psychiatry, for all other subjects, because your time is limited. Only go through the high yield topics as I have explained earlier, right? So by 8th August, all your major subjects will get completed. Okay, and then you will go with your minor subjects. Start with community health nursing. Study the community health nursing on 9th August, and on 10th August and 11th August you are going to study anatomy and physiology for 2 days, and then on 12th August you will study microbiology for 1 day and you will complete it. And then on 13th of August, what you are going to do is half a day you will study biochemistry and nutrition, rapid revision, and then half a day you will do the rapid revision of nursing research. Okay, so by 13th of August you have to complete all the subjects. The initial go through you have to complete. From 14th of August you are going to start with the revision. Okay, you are going to start with your revisions. So first revision you are going to start from 14th of August. Make sure that from 14th of August daily you do 300 to 400 MCQs. You can select any MCQ book. The sources I have already discussed in my previous video. I am giving you the link of my previous video in the description. Please check out, guys. I have discussed you the best books to do MCQs there. You can go through. You can select any one, that's sufficient. So every alternate day from 14th of August you will do grand tests also. Not daily, alternate day you have to do, right? But daily you have to practice MCQs. Okay. So now how you will revise is, so 14th of August and 15th of August, 2 days you will study obstetrics and gynecology, and 16th of August FON, and 17th and 18th of August you will study MSN, that is revision you will do, right? So 19th and 20th pharmacology you will study, and 21st and 22nd you are going to revise pediatrics, and 23rd you are going to revise entire psychiatry, and 24th of August you are going to revise the anatomy and physiology, and 25th you are going to revise half of the day for microbiology and half of the day for biochemistry and nutrition, and then 26th of August you are going to revise your community health nursing, your PSM, and then 27th of August you are going to revise, for half of the day you will revise your nursing research, and half of the day you will start with your arithmetics and reasoning. By 27th of August your first revision also will get completed. See, why I'm saying you revision is the key to success. Okay, 60% of your preparation should go for your revisions, 40% for MCQs. Okay, revisions is the main key to success. So from 28th, those who are preparing for Jipmer exam, the time planner is for you. Okay, and the Norcet time planner I will continue in a short while. Okay, From 28th of August, those who are preparing for your Jipmer exam, you will start with your second revision. Okay. 28th of August and 29th of August, you will study midwifery nursing, that is obstetrics and gynecology. Then 30th of August, you will study the FON subject, and 31st of August, you will study your medical and surgical nursing. See guys, those who are preparing for your Jipmer exam, stop your GTs by 31st. Stop doing your grand tests by 31st, okay? Because it will build up unnecessary anxiety if you still continue your grand tests. On 1st of September, you will start reading your pediatrics, and 2nd of September, you will go through your psychiatry subject, and 3rd, you will not revise any subject. Only you will study the LMR notes. What is this LMR notes is? See, I have already told you that daily you have to do 200 to 300 MCQs, right? While you are doing these MCQs, you will come to know one or two the new topics which you have not studied at all, because you have done only the rapid revision, right? So for sure you will come to know the newer MCQs, that new MCQs which you have not studied in your high yield topics. So that should go as a one-liner in LMR note. Separately place a book for as LMR notes and write the new MCQs which you don't know as one-liners. Don't write in an MCQ form, just write along with the answer as one-liner, right? Okay, that alone you are going to revise on 3rd September, and also you will revise your image library. I have already told you, right? So all images you will revise. And on 4th September 2022, everything is set for your exam and you are going to appear for your Jipmer exam. So for the Norcet exam, now the schedule continues. Start with your second revision. Okay, you have completed your first revision for Norcet, and then from 28th of August you will start with the second revision, right? So from your second revision you have to do daily GTs. Okay, every day you have to give one grand tests. Okay, you have to spend 3 hours of time to do your grand test, right? Till September 7th you will do your daily GTs, and then you will stop by September 7th. To avoid unnecessary anxiety and feeling of low esteem, stop your daily GTs by September 7th, right? So 28th of August and 29th of August, you are going to study your obstetrics and gynecology second revision. Second revision of fundamentals you will do on 30th of August, and 31st and 1st September, you will do your medical and surgical revision 2, right? On 2nd September, you will study the pharma. On 3rd September, you will do the second revision for your child health nursing, and 4th September, psychiatry, and 5th September, half of the day you will study anatomy and half of the day you will study physiology, and on 6th September, half of the day you will study microbiology, and half of the day second revision of your biochemistry and nutrition. And 7th September, you will study your community health nursing, and 8th September, half of the day for nursing research and half of the day for arithmetic and reasoning, right? And on 9th and 10th, you are not going to study anything. Only you are going to revise your LMR notes. LMR notes in the sense, see, while you are doing your MCQs daily, you will come to know few new MCQs which you have not covered in your content. While you are studying the concepts, the high yield topics which you have not covered there, you will come to know. So that MCQs you have to make as one-liners in this LMR note, and that one-liners you have to revise in these 2 days, 9th of August and 10th of August. Along with that LMR notes, you are also going to revise image library. I have already told you the image library. So you have to revise all the images, right? Instruments, catheters, color codings of all the other catheters, anesthetic agents, everything you are going to discuss, along with ECG, ABG, chest x-rays and instruments. So these to be revised on 9th of August and 10th of August. So by this, entire your preparation for Norcet 2022 exam will get completed, and on 11th of September you will appear for your Aiims Norcet exam, right? This is the time where you need to be committed to your studies and you need to be consistent. And all the best for your Norcet exam 2022. If you have any queries, you can comment it down so that I will reach you there. And I'm also giving my Insta ID in the description. If you have any doubts in the Norcet exam or in the Jipmer exam, any scientific or technical doubts you can ask. So thank you all guys for watching my video.